Today, February 7th, is National Black HIV/AIDS Awareness Day, a day to acknowledge progress in HIV prevention and care among Black African American people while recognizing the work that still needs to be done. To stop HIV, we must address HIV stigma and barriers as well as overcoming structural barriers to HIV testing, prevention, and treatment. Studies suggest that Black African Americans distrust the healthcare system. There continue to be an underlying element of mistrust between the poor populations and minority population that, in large, caused by neglect or abuse by the healthcare system. The U.S. Public Health Service untreated syphilis study at Tuskegee is a prime example. In 1932, the USPHS, working with the Tuskegee Institute, began a study to record the natural history of syphilis. It was originally called the Tuskegee Study of Untreated Syphilis in the Negro Male, but now referred to as the USPHS Untreated Syphilis Study at Tuskegee. The study initially involved 600 Black men, 399 with syphilis, 201 who did not have the disease. Participants' informed consent was not collected. Researchers told the men they were being treated for bad blood, a local term used to describe several ailments, including syphilis, anemia, and fatigue. In exchange for taking part in the study, the men received free medical exams, free meals, and burial insurance. By 1943, penicillin was the treatment of choice for syphilis and becoming widely available, but the participants in the study were not offered treatment. In 1972, an Associated Press story about the study was published. As a result, the Assistant Secretary for Health and Scientific Affairs appointed an ad hoc advisory panel to review the study. The advisory panel concluded that the study was ethically unjustified. That is, the results were disproportionately meager compared with known risks to human subjects involved. In October 1972, the panel advised stopping the study. A month later, the study ended. In March 1973, the panel also advised the Secretary of the Department of Health, Education, and Welfare, now known as the Department of Health and Human Services, to instruct the USPHS to provide all necessary medical care for the survivors of the study. The Tuskegee Health Benefit Program was established to provide these services. In 1975, participant wives, widows, and children were added to the program. The last study participant died in January 2004. The last widow receiving THBP benefits died in January 2009. Participants' children, 10 at present, continue to receive medical and health benefits.
For more perspective, here's a timeline. 30 years of HIV in Black and African American communities. 1981. CDC reports first known cases of what we now call AIDS in its Morbidity and Mortality Weekly Report. In that first month, 26 cases are described, one of whom is African American. By the following year, in July of 1982, the CDC reports more than 86 cases of AIDS have occurred among African Americans, 20% of all cases reported for that year. 1984. Dr. Robert Gallo identifies HIV as the cause of AIDS in June of 1984. The CDC reports that 50% of all pediatric AIDS cases are among African Americans. 1986. A special Morbidity and Mortality Weekly Report on AIDS amongst Blacks and Hispanics finds that African Americans account for 51% of all AIDS cases among women and have an overall AIDS rate 3 times higher than whites. 1988 through 1990. For the first time, the number of new infections among African Americans exceeds the number of infections in whites and remains that way ever since. 1989. Dancer and choreographer Alvin Ailey dies of AIDS. 1990. The Ryan White Comprehensive AIDS Resource Emergency, or CARE Act of 1990 is enacted by Congress, providing federal funds for care and treatment. 1991. NBA legend Irvin Magic Johnson announces that he is HIV positive. 1982. Tennis star Arthur Ashe announces he has AIDS. November 1993. HIV becomes the leading cause of death for African American men ages 25 to 44 and the second leading cause of death for African American women in the same age range. 1994. AIDS becomes the leading cause of all deaths for Americans ages 25 to 44. This remains so through 1995. December 1994. Ray Lewis Thornton becomes the first HIV African American woman to tell her story for a national publication in Essence magazine. 1996. HIV no longer leading cause of death for all Americans ages 25 through 44, but remains the leading cause of death of African Americans in this age group. 1999. Reggie Williams, founder of the National Task Force on AIDS Prevention and one of the Black community's first and most vocal Black gay HIV activists, dies of AIDS. 2000. HIV cases among Black and Latino men who have sex with men exceed those among their white counterparts. 2001. First annual National HIV Black AIDS Awareness Day. June 2006. CDC recommends routine HIV testing in healthcare settings for all adults ages 13 through 64. 2007. CDC launches its expanded HIV testing initiative to increase HIV testing opportunities, primarily among African Americans. 2008. New HIV incidence estimates show that the number of new infections among African Americans, though unacceptably high, has remained stable for more than a decade. 2008. Data show that 1 in 16 Black men will be diagnosed with HIV in their lifetime, as will 1 in 32 Black women. April 2009. The White House partners with CDC to launch Act Against AIDS, the first national HIV awareness campaign in 2 decades, and the Act Against AIDS Leadership Initiative, a partnership of leading Black organizations working together to fight HIV in their communities. April 2009. At the White House unveiling of the Act Against AIDS campaign, civil rights pioneer Dorothy Height urges African Americans to talk about HIV as we talk about jobs, as we talk about housing, as we talk about civil rights. July 2010. Obama administration releases the first national HIV/AIDS strategy for the United States, which calls on the nation to focus HIV prevention efforts on those at greatest risk, including African Americans. 2011. NIH publishes the results of the HPTN 52 study, which shows that taking antiretroviral drugs at the onset of HIV leads to a dramatic reduction in HIV transmission to an unaffected heterosexual partner. Today, African Americans, more than any race, have the highest rates of HIV infection in the nation. Although just 14% of the U.S. population, Blacks account for nearly half of those living and dying with HIV and AIDS. Among African Americans, gay and bisexual men are the most affected, followed by heterosexual women. AIDS is the third leading cause of death among Black women aged 25 to 34 and 35 to 44, and among Black men aged 35 to 44. If current HIV diagnosis rates persist, about 1 in 2 Black men who have sex with men and 1 in 4 Latino MSMs in the United States will be diagnosed with HIV during their lifetime, according to a new analysis by researchers at the Center for Disease Control and Prevention. Gay and bisexual men continue to be the most affected by the HIV epidemic in the U.S. At current rates, 1 in 6 men who have sex with men will be diagnosed with HIV in their lifetime, including 1 in 2 Black men, 1 in 4 Latino MSMs, and 1 in 11 white MSMs. African Americans are by far the most affected racial or ethnic group with a lifetime HIV risk of 1 in 20 for men, compared to 1 in 132 for whites and 1 in 48 for women, compared to 1 in 880 for whites. People who inject drugs are at a much higher lifetime risk than general populations, and women who inject drugs have a higher risk than men, 1 in 23 compared to 1 in 36. Ending the HIV Epidemic Initiative focuses on the 4 key strategies that, implemented together, can end the HIV epidemic in the U.S. Those 4 strategies are diagnose, treat, prevent, and respond.